How are those hip stabilization exercises coming along? We've got another progression coming up, and this one's also going to help your knees. All right, we're on to hip holds 3. This is the great exercise. It's a progression from hip holds 1, hip holds 2. So you went from your back, you went into sitting, but now we're going into a lunging position. This is a little bit more engagement, but I'm gonna use my left ACL side that I had the reconstructive surgery, and for a long time it just didn't feel normal. It wasn't my own. It didn't feel like I could push off very well. It was very uncoordinated, so it really took an exercise like this to make it that much better and increase my running ability, and also decrease some of the swelling that I was getting after some runs. I didn't realize how loose it felt after doing this exercise. So I'm gonna set up right now. All right, so here's the position we're looking for. You can start at 90 degrees, but if you're very weak, you can also lean back. I like to think of it in percentages. So right now it's only about 10%, 20%, 30%, 40%, 50, 60, 70, 80, 90, 100. All right, and you have to be strong, especially for those. I just had someone that likes to mountain climb or rock climbing, likes to rock climb, and they really need and like that knee position to be very tucked away and have strength. So you need to have some strength there. All right, so here's where you want to set it up. You're going to try to pull it up here, and you're going to pull up. I'm trying to drive the force down. Now, what you should feel is a connection that goes from my stomach actually through my deep hip muscles down through my knee, through the ankle, down towards my middle foot. And so there should feel like a connection. Oftentimes if you had a knee injury, in here it feels like there's no stability, there's no control. Now I feel like there's some muscles that really connect this. It's the soleus muscle and also your hamstring muscle. So I'm driving down the hamstring, and how do you do this? So this is a great PNF technique that I've learned, and so that's just pushing down. It's called approximating. Approximation in PNF actually causes or jump starts some stability. So now my shaking starts, and we've talked about the shaking in hip holds 1, hip holds 2. This is a progression, so once you know what to look for, you're looking for that line. Now it's kicking in finally, and it's a lot more sturdy. I should have done a little functional test to show you guys, maybe a step up or step down, but I can tell you it's gonna be more improved after this. But that's kind of the goal, so this will help. Now, as I've mastered this at, let's say 40%, you know, what we're trying to do is I can lean a little bit more. Now I'm starting to feel a little ache here, and that's when the knee is a little bit more unstable here. So what I'm gonna do here again is I'm gonna push down, and there it is. I don't have much stability. I almost lost my balance there, and I'm shaking once again. And then now my calf muscle starts coming in nicely. The hamstring, it's hard to see that because this is very much a neuromuscular exercise. But I am loading it and approximating my tibia and creating that stress through the bone, and the muscles will therefore help kick. And then I want to go to the next level, and so on and so forth. You want to make sure it's stable through the whole range. That'll help you with those that also have buckling knees when they're squatting. Also another good one to develop into. So there you have it. We've got another development of this hip hold series. Really, it's trying to get that hamstring muscle kicking in, and even some of those calf muscles to tighten up that knee joint. And especially for me, that post ACL surgery, I really needed that, and I found a great exercise to help stabilize it years after my surgery. So make sure this is the right exercise for you. You've checked with your PT or your healthcare provider, and if you like what we're doing, we're always trying to innovate and put new stuff. You can always email us if you have questions at rehabandrevivemedia@gmail.com. Don't forget to subscribe below. Also leave a like and any comments. I'm Dr. Lin. Remember, we heal smarter, not harder.